Good afternoon or good morning. This is Mike Shanley, and I am privileged to represent Symphony Corporation. And with me is Mark Butler, an account executive with Infor, and he has the same privilege of representing the Lawson product line within the Infor portfolio. This video is a short 7 or 8 minute invitation for you to join us at Torch, the Texas Organization for Rural and Community Hospitals annual conference in Dallas. We'll be in booth 52 on April 17, 18, and 19. If you're not familiar with this event, torchnet.org, terrific event. Torch represents a number of hospitals and entities, and it's a great organization, a terrific opportunity to get to meet some folks that have a lot in common. Registration deadline coming up March 28, again, torchnet.org. So a couple things we're going to do here. I'm going to share with you a couple thoughts on why we'd like to visit with you, some things we'd like to talk about. And at the end, I'm going to extend you an invitation to set up a conversation with us, and I'll show you a fun little way we're going to reward those folks that do that and help you remember booth number 52. The challenges, rather self-obvious, self-evident, the margin pressure, payment pressure, and satisfaction. This is a real challenge in all healthcare, but it seems to be particularly relevant to the rural and community hospital space. Some of the things that people in this space have talked about wanting to change. They find themselves with what we call information silos. That means different things in different places that aren't connected. The disparate nature of systems that are not connected. A lot of people doing things in Excel, a lot of things on paper. One of the results of that is some alignment challenges where people are not pursuing common goals because they don't have the ability to conveniently share data. And the end result of that is an inconsistency in the activities, and a lot of this comes back to the ability to look at data in a holistic means to do that. Well, one of the ways to do that is the Lawson Portfolio within Infor does have a nice focus in community hospitals. One thing down here, in the less than 300 bed space, over 600 hospitals are running the Lawson portfolio, and in 132 critical access hospitals, so a nice footprint in the community and rural space. The Lawson portfolio is made up of financials, human resource, or human capital management, your choice, as well as materials management. By the way, there is a really nice mobile supply chain app here for those folks that move around and carry a tablet, such as an iPad. On top of that is business intelligence, the ability to pull data out of Lawson and give you a intelligent view of what's going on and actionable intelligence around events and triggers and so forth. Love to have that conversation with you. One of the things that Lawson does have is Cloverleaf, which is a nice integration tool into your electronic medical record system and clinical apps. This is an area that Symphony is specialized in, and I'll get to that in a second. The point being is that the Lawson solution is well known, well accepted, and widely adopted in hospitals that have a lot in common with those who attend Torch. A quick comment on the leadership footprint according to HIMSS. So what does Symphony do? We are a professional services firm, and I call this a value ladder. What do we do? Under two umbrellas, we have a professional services practice built around what I'll call the admin or ERP space, particularly Infor's Lawson solution. We also have expertise on ADP because in the hospital size of those in the community and rural space, sometimes the cost justification just isn't there to roll out a full HR system, but a partial one with someone like an ADP. There are more than one way to integrate ADP data into Lawson, and we are experts on all of those. The other umbrella I mentioned under the topic of clinical, we have services expertise on Epic, Cerner, Meditech, all of the familiar names there, and particularly adept at reporting when it comes out of that. Then you get into an interesting conversation around how to integrate data from a clinical system and an admin or ERP system, again back to that disparate systems comment earlier. We also have a great deal of intelligence around BI or DW, data warehousing business intelligence. In fact, one of the nicknames we have received over the years has been, "Oh, you're the reporting guys," because we do have a very agile practice around business intelligence, the LBI Lawson Business Intelligence product, and data warehousing. We also have a population health and care management solution that we developed jointly with Johns Hopkins. And this could be a really interesting conversation in that a community hospital, somewhat by definition, looks after a sizable population. And this is in a software as a service model. That is, you pay as you go, not a big license footprint up front, and a number of things that could be of an interesting conversation there. We also have a Symphony Cloud, which is our hosting option, and the Safe Upgrade Lab, where you bring data from Lawson to our lab, do the upgrade, bring it back when you're finished, proving that the upgrade is ready to go, therefore avoiding the need to expand your technology footprint to absorb an upgrade. A lot of good things there. Safe meaning strategic, accelerated, flexible, and efficient. A couple things we do that are noteworthy. We carry the CMMI Level 4 designation from the Center of Medicaid and Medicare Innovation. A nice credential should you be looking for external assistance. A couple things we do also in the way of what I call clinical expertise. A lot of things around implementation, and again, I'm not going to read this to you, but you can see here the focus areas. Population health, I mentioned. We have helped folks with grants. I think the population health solution at Johns Hopkins may have had some of its origins in a grant application we did jointly with them. A lot of things in the business intelligence space, a lot of things in the implementation and integration space. Here's an example. This is a community hospital up in the upper Midwest. You see the employee base and the bed size there. They've already hit meaningful use stage 1. Kind of innovative in their thinking in that they invested in Cerner Clinicals, which is one of the 2 or 3 top systems, as well as a very broad footprint from Lawson, Financials, HCM, Materials Management, Mobile Supply Chain, Lawson Business Intelligence, and then also in the Infor portfolio, WorkBrain, which is a product very similar to, I think, Kronos in terms of scheduling and that kind of thing. They also use Requisition Center across all 720 employees, which means anyone in the healthcare organization can submit requisitions to the purchasing folks by way of a self-service application. The role Symphony played here was we designed and helped them roll out a strategic business intelligence approach using Lawson's business intelligence. We are presently in discussions about upgrades, maybe hosting in our Symphony Cloud, as well as integration, as I mentioned earlier. So here's a great test case for what I mentioned earlier. The theme, Executing a Winning Strategy, 2013. The value pricing works in the rural hospital space, a comprehensive approach, both software from Lawson, implementation services from Symphony, and clinical integration services from Symphony using the Lawson tools there. I mentioned proven. I think Symphony has done work for 70 of the top 100 healthcare organizations in the country. I mentioned the Lawson stats of over 600 customers in the 300 bed and below and the 132 critical care. The possibility exists, if you're interested, in a single point of accountability, a contractual service level agreement either from Lawson's hosting or the Symphony Cloud gives you a single phone number to call. And this is based on the assurance you get from the Infor and Symphony partnership. I mentioned Symphony has had a long and fruitful relationship with Lawson and now with Infor. So the next steps we'd like to think about would be an invitation for you to schedule a conversation with us while at Torch. We'd love to talk with you about and listen to your thoughts on things you want to change, get past those disparate systems, get past the misalignment, and get folks all marching on the same page, if you will. Happy to address any additional questions you have about the Lawson portfolio or the services Symphony brings to the table. And if it makes sense, then agree on some ways to assist. So Mark and my emails are here at the bottom of the page, and we'd like to hear from you. Now, let's have some fun with this. Back to Booth 52. What we'd like to do, the first 10 folks that contact us to schedule a 15-minute conversation with us at Torch, we're going to have for you there a book called 52 Projects. This is a very creative and thinking outside of the box book. You can see more about it at 52projects.com. And we reserve the right to take that list to 20 or 30 should we get more response than we're expecting. Again, the invitation to come spend some time with us and have a conversation about what you're doing and how we might help that. We're going to draw out of business cards of the folks that do spend time with us the book 52 Texas Weekends. This is a great book. My wife and I have thoroughly enjoyed this and have gotten acquainted with more of Texas than we've known just growing up here, because Texas is a pretty big place. And so if you're curious about more of Texas, come see us. So what we're going to do, an email from to either me or to Mark, we're going to check the timestamps, and we will have a book for you, and we'll have a common calendar. We'd like to schedule 15 minutes to get acquainted, understand kind of what's going on, and maybe brainstorm a little bit on some things that might make sense for us to follow up with, and we'll reward that with some gifts that help you remember booth number 52. Thank you for listening. We hope to see you at Torch, and we look forward to hearing from you.